what I would like to do is just explain a little bit about the regulatory landscape. I know you have some of that, have had some of that explained already, but you know, we implement state and federal drinking water regulations. There are over 90 standards, federal standards that we implement at the state level, and we regulate public water systems, over 3,000 in the state. And as has been mentioned and explained, cyanotoxins are unregulated and emerging contaminants. Under the Safe Drinking Water Act, it's a very rigorous process to develop new standards for new contaminants. It takes years and years of study and analysis to do that. And so what EPA has done for a certain number of unregulated contaminants, where they have health information and where they have kind of risk-based analysis done, they prepare what they refer to as health advisories for the specific contaminants. And what that is it's an analysis of available scientific information that sets levels that they deem safe, below which there would be no expectation of adverse health effects based on available scientific information. It's non-regulatory, it's non-enforceable, and so that's what we have to work with in this case. There were health advisories that EPA issued for 2 of the cyanotoxins in June of 2015, I believe. And the levels, the complicating factor with that that's sort of been explained here is that it's not just a concentration, but it's also a duration of exposure. And really that comes back to the availability of scientific information. Scientific studies that were done are over a duration that is kind of trying to look at the duration of approximating algal blooms, which are sporadic and occur over a matter of days or maybe a week or two. And so that's why they came out with a health advisory that includes concentration levels, but also has a second factor of a duration of exposure. So again, taking those 2 things together, if you're below both of those, there's no expectation, based on the available scientific information, of adverse health effects. So we, throughout this incident, were in constant contact with the city staff. I commend the city of Salem for its proactive monitoring program. You're not required to do that, but the city has chosen to do that as a good practice, and as has been mentioned, it uncovered the existence of these toxins. When the data first became available about a week ago, I think it was Friday and Saturday, I was on call that weekend, as was Casey Lyon, one of our managers. We made ourselves available throughout the weekend. We tried to explain the health advisory information to the city staff, and suggested that you have this 10-day window to make adjustments, and it's still safe. You're within a window of safety. We have no regulatory authority. It's not our role to dictate or mandate any action by the city in this environment, because again, the toxins are unregulated. There are no standards or regulations that apply to them. But we did work hand in hand with the city throughout the situation. We didn't require them to use that 10-day window, but we made that available and said, this is how we understand that this health advisory from EPA works. So it did provide an opportunity throughout the weekend for the city to make some operational adjustments. That is something that EPA fully intends while sampling is being done during an incident like this. When we got to Tuesday, we had a conference call. We brought in national experts from EPA, specifically experts on these cyanotoxins, to verify that we were applying the health advisory from EPA correctly, and to gain their counsel. What they told us was we had a decision point at that point, that working with the city. On Tuesday, we could have waited for results, which were expected by Thursday, and we would still be within the 10-day window, and it would be considered safe. Or we could, recommend that the city issue an advisory. EPA counseled us that either path would be consistent with their guidelines in the health advisory. So, listening to kind of the city's attempts to mitigate, the situation through operational changes, there wasn't entirely, I wasn't sensing a high level of confidence that was working, and we were getting a little nervous, frankly, by Tuesday. And so we did, representing the Oregon Health Authority, advise the city to issue the advisory on Tuesday. And the city took that advice, and here we are. We have since then been working with the city on, additional operational changes. We've lined up national experts at EPA to help advise the city on optimizing treatment and that sort of thing. And we stand here to assist as we go through this exercise. Obviously, you learn through these situations. We have not had a cyanotoxin episode like this that has been in the distribution system, that has made its way through the treatment system at a drinking water plant in Oregon that I'm aware of. I think so. This is a novel situation. But I think we have done the best we could to be responsible with the interest, our primary focus being on protection of public health. I think clearly we could have done much better in sharing the information that we know when we knew it, and that's just a lesson learned. I'd be happy to answer any questions at this point or later in the program.